Hi folks, Mike here. Hope you're doing well. This week's question is about attention deficit disorder. And the question is more of, is it a real entity? Another take on the topic has also been, is this an invented diagnosis so that the drug companies can benefit from this? So first, I have to make the distinction because a lot of people say, well, we didn't have attention deficit in my day because we just take a ruler and hit the kid on the back of the hand and he'd pay attention, by God. But it's not just a matter of not paying attention or having any level of distractibility. This is when it compromises your life and your lifestyle, and the kids get, it can affect their self-esteem. So while yes, it's about distractibility and not paying attention, it's a little bit more severe than that. So I'll give you the actual objective descriptions from the American Academy of Pediatrics. And for those that will have or can have a diagnosis of attention deficit, they have to have at least 6 of the following symptoms of inattention. And it's often, and this, the important word is often, not occasionally happens, but often. Fails to give close attention to details, often has difficulty maintaining attention, often does not listen when spoken to, often does not organize well, often is reluctant to engage in tasks that require a lot of mental effort, often is distracted by outside stimuli, which is a lot of us, often is forgetful of everyday activities, and or with these symptoms of hyperactivity. Fidgeting with the hands, gets up from the seat in class, sits down, gets up, sits down, often runs around or climbs when it's inappropriate. In other words, when someone's trying to talk to him or her. Can't really concentrate on playing interactively, is always go, go, go. Talks nonstop or excessively. Will blurt out answers without waiting to being called upon. Can't wait his turn, and will interrupt you or interrupt conversations. So approximately 10% of peds population has this disorder. And again, this is not just a matter of not paying attention. It's when it comes to the point that the kids can't get their day done. And it will present maybe from the school where the teacher will say, well, I told Billy to bring this, and he every single day I tell him to make sure he brings it, and he never brings it. Or you're helping him or her with her homework for 3 hours when it really should just be a 20-minute exercise, and with or without hyperactivity. Sometimes it's chores at home. I've told them a million times, I've given them a list, they never do it. He always gets up when he's trying to do his homework and I can't get him back to the table. So these are more of the clues that there's something going on. If you were to come into the office with that, we talk about it. Sometimes we'll do a screening of questions that you would answer as a parent or the teacher that kind of focuses on a problem with attention. But we generally refer the kids out to be examined by someone that does this for a living. The reason being, if your child is labeled with attention deficit with a diagnosis started on a medicine, with or without a medicine, other what are called comorbidities, or things that can be masked by attention deficit or can actually be the cause of your children not doing well in school, are labeled as attention deficit. For example, very simple things like vision, hearing, dyslexia can also be part of attention deficit, and it can be a presenting symptom on its own. Learning disability, and when I say learning disability, it doesn't mean your child has anything wrong with his brain. His brain is normal, it's just processing information. So that's why we generally like professionals to actually make the diagnosis and make sure there isn't anything else associated with the attention problem. Now, medicines, I know some people don't like to use them on their kids, but these aren't always the front line. There's behavior therapy, there's just helping the child physically in school by putting him closer to the teacher, or having the teacher help with organization by by getting a organizational list for him, by helping him or her when they come home, giving him or her some structure. So I know the answer, well, a lot of people is just medicine, but that's not necessarily what's needed. So I think that's in a nutshell. Yes, it's a real diagnosis. I don't think it's been invented for the drug companies to make money. If that were the case, then you could say that about any other type of illness or disease. But it's a straightforward issue. You just have to get to the right people and get the right diagnosis and help the kids. Anyway, that's it. Thank you very much. Sorry to kind of rushing today because I fell behind, but I hope you have a great week. And feel free to submit any more questions. I'm trying to get all of them answered. Thank you very much and have a good week.